1. Hand hygiene is the single most effective way to prevent the spread of infection in healthcare settings. True or false? Answer: true. Rationale: proper hand hygiene, including hand washing and alcohol-based hand rubs, is the cornerstone of infection prevention, as emphasized by the CDC and WHO, reducing healthcare-associated infections significantly. 2. Standard precautions apply only to patients with confirmed infectious diseases. True or false? Answer: false. Rationale: standard precautions apply to all patients, regardless of infection status, to prevent transmission of pathogens via blood, body fluids, or mucous membranes, as per CDC guidelines. 3. The nurse should raise the side rails for a patient at risk for falls. True or false? Answer: true. Rationale: raising side rails is a safety intervention for patients at risk for falls, particularly those with altered mental status or mobility issues, to prevent injury, per Joint Commission standards. 4. Verbal orders should never be accepted by a nurse. True or false? Answer: false. Rationale: verbal orders can be accepted in urgent situations, but must be documented immediately and verified by the prescriber within a specified timeframe, per facility policy and safety standards. 5. Turning a patient every 2 hours prevents pressure injuries. True or false? Answer: true. Rationale: repositioning every 2 hours redistributes pressure, promotes circulation, and prevents pressure injuries in immobile patients, as recommended by Wound Care Guidelines. 6. A blood pressure of 140/90 mmHg is considered normal for an adult. True or false? Answer: false. Rationale: a blood pressure of 140/90 mmHg is classified as stage 1 hypertension per the American Heart Association, requiring monitoring and possible intervention, not considered normal. 7. Hypokalemia can cause muscle weakness and arrhythmias. True or false? Answer: true. Rationale: hypokalemia, low potassium, disrupts muscle and cardiac function, leading to weakness, cramps, and arrhythmias, requiring electrolyte replacement and monitoring. 8. Medications should be administered within 15 minutes of the scheduled time. True or false? Answer: false. Rationale: medications should be administered within 30 to 60 minutes of the scheduled time, per facility policy, to maintain therapeutic levels, unless specified as time-critical. 9. Non-pharmacological pain interventions include guided imagery. True or false? Answer: true. Rationale: guided imagery is a non-pharmacological pain intervention that uses relaxation and visualization to reduce pain perception, complementing pharmacological approaches. 10. Nurses can delegate vital sign measurements to unlicensed assistive personnel. True or false? Answer: true. Rationale: nurses can delegate stable vital sign measurements to trained unlicensed assistive personnel, but must interpret results and assess unstable patients themselves, per scope of practice. 11. Informed consent is required only for surgical procedures. True or false? Answer: false. Rationale: informed consent is required for any invasive procedure, treatment, or research, ensuring patients understand risks, benefits, and alternatives, per ethical and legal standards. 12. Cultural competence includes respecting a patient's dietary preferences. True or false? Answer: true. Rationale: cultural competence involves respecting and accommodating patients' cultural beliefs, including dietary preferences, to provide patient-centered care and build trust. 13. Therapeutic communication avoids using open-ended questions. True or false? Answer: false. Rationale: therapeutic communication encourages open-ended questions to elicit patient concerns and promote dialogue, fostering trust and understanding in the nurse-patient relationship. 14. A pulse oximetry reading of 88% is within normal limits. True or false? Answer: false. Rationale: a pulse oximetry reading below 95% indicates hypoxemia, requiring assessment and intervention, as normal oxygen saturation is 95 to 100% in healthy adults. 15. Personal protective equipment, PPE, is required only for airborne precautions. True or false? Answer: false. Rationale: PPE is required for all transmission-based precautions, airborne, droplet, contact, and certain standard precaution scenarios, depending on the risk of exposure, per CDC guidelines. 16. The nurse should check 2 patient identifiers before administering medication. True or false? Answer: true. Rationale: checking 2 patient identifiers, e.g., name, date of birth, before medication administration ensures patient safety and prevents errors, per Joint Commission standards. 17. Fluid overload can cause peripheral edema and shortness of breath. True or false? Answer: true. Rationale: fluid overload increases intravascular volume, leading to peripheral edema and pulmonary congestion, causing shortness of breath, requiring monitoring and diuretics. 18. Pain assessment is only necessary for postoperative patients. True or false? Answer: false. Rationale: pain assessment is essential for all patients, as pain can occur in various conditions, e.g., chronic illness, trauma, guiding appropriate interventions, and improving comfort. 19. Nurses are legally responsible for reporting suspected abuse. True or false? Answer: true. Rationale: nurses are mandated reporters and must report suspected abuse or neglect, e.g., child, elder, domestic, to authorities, per state laws and ethical obligations. 20. A patient's chart should include only objective data. True or false? Answer: false. Rationale: a patient's chart includes both objective data, e.g., vital signs, lab results, and subjective data, e.g., patient complaints, history, to provide a comprehensive clinical picture. 21. Proper body mechanics prevent nurse injuries during patient transfers. True or false? Answer: true. Rationale: using proper body mechanics, e.g., bending knees, keeping back straight, reduces musculoskeletal strain and prevents injuries when transferring patients, per OSHA guidelines. 22. Oral care should be performed only once daily for bedridden patients. True or false? Answer: false. Rationale: oral care should be performed at least twice daily, or more frequently, for bedridden patients to prevent infections, maintain comfort, and promote oral health. 23. The 5 rights of medication administration include right documentation. True or false? Answer: true. Rationale: the 5 rights of medication administration are right patient, drug, dose, route, and time, with right documentation often considered a 6th right to ensure accuracy and accountability. 24. A temperature of 37.5 degrees Celsius is considered febrile. True or false? Answer: false. Rationale: a temperature of 37.5 degrees Celsius (99.5 degrees Fahrenheit) is slightly elevated, but not typically considered febrile, which is defined as 38 degrees Celsius (100.4 degrees Fahrenheit) or higher, requiring further assessment. 25. Restraints should be used as the first intervention for agitated patients. True or false? Answer: false. Rationale: restraints are a last resort for agitated patients. After de-escalation, environmental modifications, and other interventions fail, per CMS and Joint Commission standards. 26. Active listening is a key component of therapeutic communication. True or false? Answer: true. Rationale: active listening, including eye contact and nonverbal cues, demonstrates empathy and encourages patients to express concerns, enhancing therapeutic communication. 27. Hypocalcemia can cause tetany and seizures. True or false? Answer: true. Rationale: hypocalcemia, low calcium, disrupts nerve and muscle function, leading to tetany, muscle spasms, and potentially seizures, requiring calcium replacement and monitoring. 28. Nurses should administer medications prepared by another nurse. True or false? Answer: false. Rationale: nurses must prepare and administer their own medications to ensure accuracy and prevent errors, verifying the drug, dose, and patient, per medication safety protocols. 29. Non-slip socks are a fall prevention strategy for hospitalized patients. True or false? Answer: true. Rationale: non-slip socks provide traction, reducing fall risk for patients, especially those with mobility issues, as part of a comprehensive fall prevention plan. 30. Incident reports are included in the patient's medical record. True or false? Answer: false. Rationale: Incident reports are separate from the medical record, used for quality improvement and risk management, to maintain confidentiality and avoid legal implications. 31. A respiratory rate of 10 breaths per minute is normal for an adult at rest. True or false? Answer. False rationale. A normal respiratory rate for an adult at rest is 12 to 20 breaths per minute. 10 breaths per minute indicates bradypnea, requiring further assessment. 32. Standard precautions include wearing gloves during all patient interactions. True or false? Answer. False rationale. Standard precautions require gloves only when contact with blood, body fluids, or mucous membranes is likely, not for all interactions, to balance safety and practicality. 33. The nurse should assess a patient's pain using a 0 to 10 scale. True or false? Answer. True rationale. The 0 to 10 numeric pain scale is a standard tool to quantify pain intensity, aiding in assessment, treatment planning, and evaluation of interventions. 34. Nurses can share patient information freely with family members. True or false? Answer. False rationale. Nurses must protect patient confidentiality under HIPAA, sharing information with family only with patient consent or in specific circumstances, per legal and ethical standards. 35. Sequential compression devices prevent deep vein thrombosis. True or false? Answer. True rationale. Sequential compression devices promote venous return in immobile patients, reducing the risk of deep vein thrombosis, a common complication in hospitalized patients. 36. A patient's weight should be measured weekly in the hospital. True or false? Answer. False rationale. A patient's weight should be measured daily or as ordered in the hospital to monitor fluid status, nutritional needs, or medication dosing, especially in critical conditions. 37. The nurse should document care before it is provided. True or false? Answer. False rationale. Documentation should occur after care is provided to ensure accuracy and reflect actual interventions, per nursing standards and legal requirements. 38. Elevating the head of the bed reduces aspiration risk in enteral feeding. True or false? Answer. True rationale. Elevating the head of the bed to 30 to 45 degrees during enteral feeding reduces the risk of aspiration by promoting gastric emptying and preventing reflux. 39. Nurses are responsible for verifying informed consent before procedures. True or false? Answer. True rationale. Nurses verify that informed consent is documented and the patient understands the procedure, ensuring ethical practice, though the provider obtains the consent. 40. A heart rate of 110 beats per minute is normal for an adult at rest. True or false? Answer. False rationale. A normal resting heart rate for an adult is 60 to 100 beats per minute. 110 beats per minute indicates tachycardia, requiring assessment for causes like pain or anxiety.